Hi, Gemma. So this is Gemma. She initially presented to us for non-ambulatory tetraparesis. She had an MRI and CSF, and it was consistent with presumptive MUE, or meningitis of unknown origin. We started her on prednisone and cytosar, and she got dramatically better. We're currently in the process of kind of extending out her cytosar intervals and then gradually weaning her prednisone. Okay. Good job, kiddo. She can go back to ICU and she'll get her treatment. I'll talk to Dr. Tebow. So Gemma looks great. Last time we extended her cytosar intervals to 6 weeks. So this is her first time at 6 weeks. She's still doing really well. Her neurologic exam is normal. She's on a 0.3 mg/kg dose of prednisone SID. Since it's been 6 weeks and she's doing well, can we go to EOD?
Yeah, that's totally fine. Beaker has a history of 3 episodes in the last 3 years of back pain, typically characterized as ataxia, neck pain, vocalization, and difficulty turning his head. Typically gets better with medical management within like 1 to 2 weeks. Owner is unsure what we would typically give him. 8 days ago, he began to show discomfort and bloated abdomen.
So we just finished talking to Beaker's dad. Beaker is a 13, almost 14-year-old male neutered Dachshund who has progressively been having difficulty walking in all 4 legs for the last maybe 3 or 4 days. So on his neurologic exam, he wasn't able to stand or walk without any support. When we did support him, which you'll see, he can move his right back leg pretty strongly. His right front leg will show a little bit of advancement kind of around the shoulder, but there's no movement at all in his left legs. And then he was also pretty painful when we touched around his neck. His postural reactions or conscious proprioception or placing in his front legs and his left back leg were absent, so he just left them upside down. He did replace it in his right back leg, so everything kind of pointed towards a problem affecting his cervical spinal cord or the spinal cord of his neck. He's had a flare-up of 3 episodes of neck pain kind of throughout the last couple of years, and other medical history is that he had an anal gland carcinoma that was removed a little bit ago, but it doesn't sound like it's metastasized anywhere or spread anywhere else, so predominantly worried about a problem affecting his neck. Most common thing that we see to affect the neck is a slipped disc, whether that's an acute or a chronic disc. He's older, so they're gonna have more chronic discs that can flare up again in the future. Other things like tumors, infections, meningitis, what have you, strokes to the spinal cord as well. So we just are getting him admitted for an MRI, and then if it's a slipped disc, we'll do surgery today. So we'll see how it goes. So we're finishing up with Beaker's MRI. So we did an MRI of the spinal cord of his neck. Kind of right around here you start to see, and I'll kind of go through the different slices and the sequences, but there's some interruption of the CSF and the fluid here and the epidural fat. As we're taking kind of the transverse images throughout, so kind of like basically bread slices throughout the spinal cord is supposed to be kind of nice and round, where you have that nice white line around it. When we start to get to this area where it's at what we call C3 and C4, so the 3rd and 4th bone of the cervical spine, you get a lot of disruption of that spinal fluid intensity and that epidural fat. You can also see that the spinal cord is really compressed at this image. Because of how compressed it is, and this is a pretty good image to show you, usually for most spinal cord things, like if it is a slipped disc, if it's very midline, we can do a ventral slot. With him, his signs are very lateralized, so the left side being very affected, and then even in the MRI, the disc or the compressive material is more so left-sided. So what me and Dr. Tebow are going to do is we're going to do a cervical hemi, just because it gives us a little bit more exposure and availability to kind of get all of that material on that one side, since it's not just directly on midline. So, yeah. So we just finished up surgery with Beaker. So he had a C3, C4 cervical hemiluminectomy. Surgery went really well. There was definitely a lot of disc material that was there that was kind of compressing the spine over to the right side. But we got a lot of disc material out. He's in recovery right now. So hopefully he'll get better and we'll kind of see how he goes to me.